Self-harm and suicide in borderline personality disorder, BPD. Why many people with BPD experience suicidal thoughts. Borderline personality disorder, BPD, is a mental health condition marked by emotional instability, impulsivity, and a profound fear of abandonment. One of the most troubling aspects of BPD is the high prevalence of self-harm and suicidal thoughts among those who live with the disorder. People with BPD often experience intense emotional pain, emptiness, and confusion, which can lead them to engage in self-destructive behaviors or contemplate suicide as a way to cope with overwhelming feelings. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore why suicidal thoughts are so common in individuals with BPD, how these thoughts are connected to the underlying emotional turmoil, and what can be done to help those who are struggling with these dangerous thoughts. Understanding the root causes of suicidal ideation in BPD is essential for offering support and fostering healing. 1. The emotional pain behind suicidal thoughts in BPD. People with BPD often experience extreme emotional pain that can feel unmanageable. Their emotional responses are intense and fluctuate rapidly, leading to a sense of chaos and instability. The pain is not just about external events, but about an internal sense of emptiness, shame, and rejection. These feelings can be so overwhelming that they may lead individuals with BPD to believe that suicide is the only way to escape the pain or rejection they perceive in their lives. 1.1 Emotional dysregulation in BPD. One of the hallmarks of BPD is emotional dysregulation. Individuals with BPD experience emotions more intensely than others and have difficulty managing or controlling these emotions. A minor disagreement or perceived abandonment can cause extreme emotional distress, leading to feelings of hopelessness and despair. Key fact: these intense emotional reactions often result in self-destructive behavior, including self-harm or thoughts of suicide, as individuals with BPD struggle to regulate their emotions. 1.2 Fear of abandonment and suicidal thoughts. Fear of abandonment is another key factor contributing to suicidal thoughts in people with BPD. Individuals with BPD often experience an overwhelming fear of being rejected or abandoned by those they are close to. This fear can cause them to feel worthless and unlovable, leading them to self-harm or consider suicide as a way to stop the pain caused by perceived rejection. Example: a person with BPD may feel rejected by a friend who cancels plans. This can trigger intense feelings of emptiness and worthlessness, which may lead them to engage in self-harming behaviors or contemplate suicide. Key fact: suicidal thoughts often arise in response to relationship conflicts or the fear that a person with BPD will be abandoned or unwanted, which intensifies their emotional pain and feelings of despair. 2. Impulsivity and suicidal behavior in BPD. Another core characteristic of BPD is impulsivity, which can contribute to suicidal behavior. Individuals with BPD often struggle to control their impulses, and this lack of control can lead to impulsive suicide attempts or self-harm during moments of emotional distress. 2.1 Impulsivity in response to emotional pain. People with BPD may act impulsively in response to emotional crises, without fully considering the long-term consequences of their actions. Suicidal thoughts may emerge in response to emotional pain, and in moments of overwhelming distress, individuals may act on these thoughts impulsively. Example: an individual with BPD might be feeling rejected or abandoned and, in a moment of emotional overwhelm, may impulsively engage in self-harm or attempt suicide to escape their emotional pain. Key fact: impulsivity increases the risk of impulsive suicide attempts, which can be life-threatening, especially when individuals are not able to regulate their emotions and impulses. 2.2 The role of emotional crisis. Suicidal ideation and self-harming behaviors in BPD are often linked to emotional crises that feel overwhelming and unmanageable. These crises can be triggered by relationship problems, stress, or internal conflict. When these emotional experiences feel unbearable, individuals with BPD may resort to self-harm or suicide as a way to cope with the pain. Key fact: suicidal behavior in BPD is often an immediate response to emotional crises or perceived rejection, rather than a long-term plan or desire to die. 3. Self-harm as a coping mechanism. While self-harm is not always intended as a means to end one's life, it is often linked to suicidal thoughts and behaviors. For many individuals with BPD, self-harm is used as a way to manage overwhelming emotions, express pain, or regain control over feelings of emptiness or worthlessness. 3.1 The role of self-harm in emotional regulation. Self-harm, such as cutting or burning, is often a way for individuals with BPD to feel some sense of relief from emotional numbness or internal chaos. The physical pain temporarily distracts from the emotional turmoil, providing a way to feel real again. However, this behavior can also be a cry for help or a coping mechanism when other forms of emotional expression feel inaccessible or ineffective. Example: someone with BPD who feels disconnected from their emotions might resort to cutting or hitting themselves to feel a physical sensation that temporarily interrupts the emotional numbness or emotional overload. Key fact: self-harm provides a temporary escape from emotional pain but often reinforces the cycle of emotional dysregulation, leading to a need for continued self-destructive behavior. 4. Why suicidal thoughts are often misunderstood in BPD. Suicidal thoughts and self-harming behaviors in individuals with BPD are often misunderstood as attention-seeking or manipulative. However, for individuals with BPD, these behaviors are a desperate response to deep emotional pain, and they are not intended to manipulate others but to cope with feelings of emotional overwhelm and isolation. 4.1 Misconceptions about suicidal behavior in BPD. Suicidal ideation in BPD is often viewed through the lens of manipulation or attention-seeking, but this misunderstanding fails to recognize the depth of emotional suffering that individuals with BPD are experiencing. Suicidal thoughts are often a response to emotional pain, rather than an attempt to manipulate others. Key fact: suicidal thoughts in BPD are not about attention-seeking, they are about coping with emotional distress and the inability to manage intense feelings of emptiness, fear, and abandonment. 4.2 The need for compassion and support. When someone with BPD expresses suicidal thoughts, it is a sign that they are struggling with emotional pain that feels too much to bear. Rather than viewing these thoughts as manipulative, it is important for family members, friends, and clinicians to offer compassionate support and encourage the individual to engage in therapeutic treatment. Key fact: suicidal thoughts in BPD should be met with empathy, not judgment. Providing validation and emotional support can help individuals with BPD feel less isolated and reduce the risk of self-harm and suicide. 5. Treatment for self-harm and suicidal thoughts in BPD. There are effective treatment options available that can help individuals with BPD manage self-harm and suicidal thoughts. Dialectical behavior therapy, DBT, is one of the most effective therapies for BPD, specifically designed to help individuals regulate emotions, manage impulsivity, and develop healthier coping mechanisms. 5.1 Dialectical behavior therapy, DBT. DBT is an evidence-based therapy that focuses on mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness. It teaches individuals how to tolerate emotional distress without resorting to self-harm or suicidal behavior. Key fact: DBT has been shown to reduce self-harm and suicidal thoughts in individuals with BPD by teaching them healthier ways to cope with emotional crises. 5.2 Cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, helps individuals with BPD identify and challenge negative thought patterns that contribute to emotional dysregulation and suicidal ideation. CBT can help individuals with BPD develop a more realistic, balanced way of thinking about themselves and their emotions. 5.3 Support and medication. While therapy is crucial, individuals with BPD may also benefit from support groups and medication to manage comorbid conditions such as anxiety or depression. Medications such as antidepressants or mood stabilizers may be prescribed to help manage symptoms and reduce the frequency of suicidal thoughts. 6. Conclusion. Suicidal thoughts and self-harm behaviors are deeply painful and dangerous aspects of borderline personality disorder, BPD. These behaviors are often a response to overwhelming emotional pain, fear of abandonment, and emotional dysregulation. Rather than being a sign of manipulation, Suicidal ideation in BPD is often a desperate cry for help, signaling the need for professional intervention and compassionate support. With the right treatment, such as dialectical behavior therapy, DBT, individuals with BPD can learn to manage their emotions, reduce impulsive behaviors, and develop healthier coping mechanisms. By offering empathy, validation, and encouragement to seek treatment, family members and loved ones can play an important role in supporting someone with BPD and reducing the risk of self-harm and suicide. In future episodes, we will continue to explore how to support individuals with BPD, how to prevent self-harm and suicidal behaviors, and how to create a therapeutic environment for healing. Stay tuned for more insights on borderline personality disorder, BPD, and the path toward recovery. For Omni,